In this video, I would like to think about a very specific physical sign that is really important in pediatrics. It's got a slightly odd title, and I'd like to explain why. When we think about rashes in children, we will see lots of children with rashes. And it's really important that we have a structured approach to thinking about rashes. My personal approach is to ask myself three questions. First off, do I recognize this rash? If a child's got chickenpox, I know what that looks like and I can diagnose it. Sometimes I will recognize a rash that I'm very worried about or a rash that I'm not worried about. If I don't recognize the rash, I ask myself a second question. Does this rash have any serious features to it? I would consider that a rash that is evolving and getting worse rather than one that comes and goes is more worrying to me. I would consider that a rash that's associated with other local symptoms such as pain or the skin is breaking down, there's ulceration, other things relating to the rash I would be more worried about. I would then ask myself a third question, which is this a rash in a well child? Because if it's a well child, then I've got time to make the diagnosis. But if it's an unwell child, then I need to crack on. And if I can't make the diagnosis, I need to get somebody who can. So my very basic approach to rashes is to ask these three questions. Do I recognize it? Does it have any serious or sinister features to it? And is the child sick or well? What I'd like to focus on for the rest of this is the rash that I do recognize because it is non-blanching, that does have serious or sinister features. In other words, non-blanching rashes are by definition of concern, and that may be associated with a very sick child. So a non-blanching rash, I would think of differently from a blanching rash, in as much as when I press on the skin in a blanching rash, I push the red cells out of the capillaries and the skin goes pale. Whereas if the blood is extravascular outside of the blood vessels, when I press on it, it stays there, it can't go anywhere. So a non-blanching rash would include things like petechiae, which are the little dot-like lesions that we might see. It will include purpura, which are a few millimeters bigger and have a purplish sort of appearance to it. And then it will include bigger lesions, what we might call bruises, or if it's a very large collection of blood, a hematoma or an ecchymosis is a word you might hear. Then we have to ask ourselves a question. If this blood has leaked out of the blood vessels, why might this have happened? Generally, the blood will have leaked out of the vessel because of trauma. And then we have to ask ourselves a question, which is there a traumatic explanation for this? In other words, if I fall off my bike, I'm going to have bruises. That's just a normal thing. So I have extravascular blood that is entirely in keeping with the stated mechanism of injury. I fell off my bike. If I'm a 2-week-old baby who's not running around, not doing anything, who's got bruises on their back, that is not normal. That is not consistent with, I think I might have put the baby into its pushchair in a funny way. Bruising in a non-ambulant baby is a real concern because we have to ask ourselves, is this bruising consistent with the stated mechanism of injury? And if it's not, then our differential includes two main things. One is that the stated mechanism of injury is not true. In other words, somebody has done something bad to this child. This is just as true in a vulnerable child as it is in a vulnerable elder or in a victim of domestic violence. But we're going to focus on children here because this is a pediatric attachment. And specifically, we have the bruised baby protocol for non-ambulant children who have bruises. And I would expect that you have spoken with somebody and hopefully seen a child going through this protocol. It is really important that we know how to do this, but it is also important that we understand that a child might have bruising or purpura or petechiae, in other words, extravascular blood, that has not happened through trauma that really can explain it, where the problem is not that the traumatic explanation is a lie, but just that that degree of trauma should not have caused bleeding or bruising, but the bleeding and bruising has occurred because of a pathological process. So when I'm approaching a child with extravascular blood, with petechiae, purpura, or bruises, I have to ask myself a question. Is this in keeping with the stated mechanism of injury? Because if it's not, either the story doesn't match, or I've got to think of bleeding or bruising problems. And often I will think about safeguarding and bleeding and bruising problems together, because that's my job. My job is to have a differential diagnosis and do an appropriate history, appropriate examination, and appropriate investigations and escalation, whether that's escalation to children's services or to a hematologist or to an infectious diseases expert or intensive care. If a person has got abnormal bleeding or bruising, I would think of this in terms of blood problems and blood vessel problems. In other words, either there's a problem with the blood vessel, which means that they're too leaky, or there's a problem with the blood, which means it doesn't coagulate properly when there's minor trauma. I tend to think of the blood vessel problems in terms of inflammation in that vessel. There will be other rare causes of collagen problems, such as Ehlers-Danlos syndrome or Marfan syndrome or vitamin C deficiency. But most of the conditions we see of blood vessel problems are either because the blood vessel is inflamed because of infection, like in meningococcal sepsis, or inflamed because of an autoimmune process, such as henoch-schönlein purpura. And this is where it becomes so important to both be able to spot the purpura, but also think, is this a sick child who might have meningococcal disease that I need to crack on and save their life now? Or is this a child who looks relatively well, where I shouldn't forget about infectious causes, but I can also think about other things such as HSP or other rarer causes of blood vessel problems? If the blood vessels are healthy and normal, and the bleeding problem relates to a blood problem, well, there are going to be two systems that are important to us when we try and make a clot. Those are going to be the cells, the platelets, and you might have a platelet problem, or the proteins that are important for coagulation. And so, as clinicians, we are going to have to think when we see a child with a non-blanching rash, we recognize this non-blanching rash. We're going to think, is this in keeping with a stated mechanism of injury? Is this a safeguarding concern, or is this a medical concern? Might the medical concern be that there's a blood vessel problem, such as sepsis from meningococcal sepsis or henoch-schönlein purpura? Or is there a blood problem, such as low platelet counts or clotting problems? Now, I'm not going to go into these particular differentials in any more detail than that. This is not the purpose for me the time really for me to discuss details about coagulation cascade problems or causes of thrombocytopenia. The approach to the thrombocytopenia is going to be very similar to the approach I discussed with anemia, and it's one that you need to be thinking about. And there are specific things that we think about when we're thinking about children with bruises and bleeding. Specifically, we worry about bone marrow problems such as leukemia, and we worry about platelet consumption things, something called ITP, idiopathic thrombocytopenic purpura. But for the purposes of this, what I'd really like you to have in your head for this session is a robust way of thinking about rashes in children, thinking about non-blanching rashes in children, and thinking about how you assess those children, both in terms of the history you take, thinking about blood disorders, infection problems, blood vessel problems, but also safeguarding. And then thinking about how you're going to examine the child, thinking about the distribution of the non-blanching rashes, the description, whether it's petechiae or purpura or bruises, and thinking about other physical signs, such as if the patient was very unwell and you were worrying about sepsis, or had a distribution that you might associate it with henoch-schönlein purpura, or had other problems that might suggest a blood system problem like severe anemia or lots of lymph nodes or a big liver or big spleen.